Today, we are covering psychotropic medications, a topic the NCLEX loves to test through safety and patient education questions. Let's start with antidepressants. When you see an SSRI like fluoxetine or sertraline, your first thoughts must be the 2 to 4 week delay for therapeutic effects and the critical black box warning for increased suicidal ideation, particularly in adolescents and young adults. The exam will give you a scenario about a young patient starting an SSRI who suddenly reports feeling more energetic but still expresses hopelessness. This energy surge without a mood lift is a red flag for increased suicide risk, making it your priority assessment. A common trap is confusing SSRIs with tricyclic antidepressants, or TCAs, like amitriptyline. While SSRIs can cause serotonin syndrome with symptoms like agitation, hyperthermia, and tremors, TCAs are notorious for their anticholinergic effects. Think blurred vision, urinary retention, and constipation, and most importantly, cardiotoxicity. An EKG is crucial before starting a TCA, and an overdose is a medical emergency. Now for antipsychotics. The exam will test your ability to differentiate between first-generation or typical antipsychotics like haloperidol and second-generation or atypical ones like clozapine and risperidone. For typicals, think of extrapyramidal symptoms or EPS. You need to recognize acute dystonia, akathisia, and Parkinsonism. For atypicals, the big concern is metabolic syndrome, so you must monitor weight, blood glucose, and lipid levels. Clozapine carries a unique, life-threatening risk of agranulocytosis, requiring strict white blood cell monitoring. A major safety alert is neuroleptic malignant syndrome, or NMS, a rare reaction to antipsychotics. The key mnemonic here is fever, standing for fever, encephalopathy, vitals unstable, elevated enzymes, and rigidity of muscles. Don't confuse this with serotonin syndrome. NMS has lead pipe muscle rigidity and a high fever, while serotonin syndrome often presents with tremors and hyperreflexia. Let's move to mood stabilizers, specifically lithium. The NCLEX demands you know its narrow therapeutic range, typically 0.6 to 1.2 milliequivalents per liter. Anything above 1.5 is toxic. Exam questions will test factors that increase lithium levels. Watch for decreased sodium intake, dehydration, and concurrent use of NSAIDs or thiazide diuretics. Signs of toxicity start with nausea and fine hand tremors, but can progress to confusion, ataxia, and seizures. Patient education about maintaining consistent salt and fluid intake is a testable priority. Finally, let's discuss anti-anxiety medications, specifically benzodiazepines like lorazepam and diazepam. Their major risk is CNS depression, which is dangerously potentiated by alcohol or other CNS depressants. The priority nursing assessment is always respiratory status. The exam loves to test your knowledge of the antidote for benzodiazepine overdose, which is flumazenil. Remember that these are intended for short-term use due to the high risk of dependence. Mastering these key differences, adverse effects, and more specific symptoms and summary and nursing priorities will prepare you for the complex scenarios the NCLEX will present.